When taking Cranberry, it's important to follow the directions on the product package. If you're taking a chewable form, make sure to chew thoroughly before swallowing. If you have any questions or concerns, it's best to consult with your doctor or pharmacist. If your condition persists or worsens, or if you experience symptoms of a urinary tract or bladder infection such as fever, burning or painful urination, or frequent urination, it's important to inform your doctor. In some cases, you may need medication such as antibiotics to treat the infection. If you believe you have a serious medical issue, seek medical help immediately. Remember to always follow the recommended dosage and timing for best results. If you take very large doses of Cranberry, you may experience stomach upset or diarrhea. If these symptoms persist or worsen, it's important to contact your doctor or pharmacist. Seek immediate medical attention if you experience severe stomach or abdominal pain, as this can be a serious side effect of Cranberry. While it's rare, a serious allergic reaction to Cranberry can occur. If you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so if you notice any other effects, it's important to talk to your doctor or pharmacist. If you're in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Cranberry, it's important to talk to your doctor or pharmacist if you have any allergies or health conditions. This product may contain ingredients that can cause allergic reactions, so it's important to get more details from your pharmacist. If you have kidney stones or other health problems, it's best to consult with your doctor or pharmacist before using Cranberry. Liquid and chewable forms of Cranberry may contain sugar or alcohol, so if you have diabetes, liver disease, or other conditions that require you to limit these substances, it's best to ask your doctor or pharmacist about using this product safely. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use Cranberry if it is clearly needed and discuss the risks and benefits with your doctor. It's also important to consult your doctor before using Cranberry if you are breastfeeding. Always talk to your healthcare provider before starting any new medication or supplement. Interactions with other drugs and medications could affect how Cranberry works in your body, and may increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without consulting your doctor first. If someone has taken too much Cranberry and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Make sure to keep all of your medical and lab appointments to ensure that you are using Cranberry in the most effective way. This will help to monitor your progress and make any necessary adjustments to your treatment plan. If you forget to take a dose of Cranberry, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take the next dose at your regular time. Do not take a double dose to make up for the missed one. Make sure to check the storage information printed on the package and ask your pharmacist if you have any questions. It's important to keep all medications and herbal products out of reach of children and pets. Avoid flushing medications down the toilet or pouring them into a drain unless instructed to do so. When the product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.